Assalamu alaikum. Today we discuss serpiginous complex ventricular rupture. Uh, why we do surgery for serpiginous VSAR and not interventions. In this video, you will know what serpiginous VSAR is and why we do surgery for it and not interventions. First, what is VSAR? VSAR mean ventricular septal rupture. What is ventricular septal rupture? The mechanical complication of acute myocardial infarction in which the ventricular septal rupture and the blood flows abnormally from left to right ventricle. It can be simple or it can be complex serpiginous. What does serpiginous means? Serpiginous is a snake-like irregular path. Rupture has tortuous zigzagging track. Other often occur in inferior MI involving inferior basal septum. I will show you diagram and real echo videos also. Look at this diagram. The A is a true rupture of the inferior basal. True rupture, uh, ventricle septal rupture. The blood from the left ventricle goes to the right ventricle. But look at the B. This rupture has make a tunnel shape, serpiginous snake-like tunnel shape, and that why the intervention uh, doesn't work here, and the doctors do surgery for it. And look also these diagrams. Uh, the the first one is simple, straight track of the ventricular septal rupture. It is a simple ventricular septal rupture, and the second one is a complex or serpiginous VSR. Look at the track, the zigzagging track, and the uh, snake-like tortuous shape of the ventricular septal rupture. The other is the free wall rupture 1, 2, and 3. So these also you should know why the samples we can do it for intervention, and the serpiginous or complex we do it for surgery. This is the real video, and look at the short axis view. The inferior basal septum is ruptured and the blood goes from the left ventricle to the right ventricle. And in the fourth chamber, you should also see the mid septums also rupture. So this is the uh, uh, serpiginous type we saw, because the real location of the rupture is the inferior basal septum site, and the turn goes to the mid septum also. So that's why we shouldn't close it by intervention, and we do it for surgery. Features of serpiginous VSAR is complex and irregular rupture path, friable infarcted tissues, multiple entry and exit points, not suitable for device closures. Why device closure fails? Because the clean edges and staple rims are needed for the device closure, but in serpiginous there is no clean edges and stable rims. Serpiginous VSR is an irregular and unstable pathways, and device may fail to seal entire path. Risk of residual shunt or embolizations. Surgical management is the only option. Surgery involves resections of necrotic tissues, patch repairs of septums, cardiopulmonary bypass support is essential. Urgent referrals is critical. And diagnosed with imaging is echocardiography is key. Look for complex color Doppler jets, inferior and basal septum involvement. Use 3D echo or cardiac MRI for mapping. So summary is a serpiginous feature is equal to complex and unstable. Both are the same. Not suitable for percutaneous closure. Then surgical repair is life saving. Think serpiginous in the post inferior MI with the multiple jets. And thank you. Like, share, and subscribe for more cardiology contents. Not always are created equal act urgently.